Hello and welcome to Pune Times Mirror. In today's podcast, we will discuss robotic joint replacement and orthopedics with Dr. Anikhet Patil, who is with us today. I'm Prince Chaudhary, your host. Welcome to the show, Dr. Patil. Let's get started. So, my first question to you is what is robotic joint replacement surgery? If you can tell our viewers.
Yeah. So basically, joint replacement surgery is very advanced technology nowadays we are doing for the knee arthritis and hip arthritis. So last 4 to 5 years, technologies evolved to the new advanced, more precise technologies called a robotic technology. So most of the people they think robot means robot will come and operate and will go, but it is not like that. Robotics is a one technology will helps us. So this is our good assistance in surgery. So whatever is precise condition in the knee replacement surgery, hip replacement surgery, that is you are cutting the bone properly. If you make a 1 degree or 1 millimeter angle, that implant is going to fit in improper position. So bone cutting is very important portion in joint replacement surgeries, and along with that, ligament balancing. So these two important things are done by the robots, and rest everything is done by the doctors only. So what we achieve with this is good precision in the joint replacement surgery, and because of that, we will get the good results after surgery.
So, doctor, also tell us what do you find most rewarding about your role as a joint replacement surgeon? What are some common myths and facts that you have about joint replacement surgery?
Okay. So as I explained, it is one of the most successful surgery in the era of the medicine. So patients generally they are crippling, they don't start walking for initially 3 years, 4 years, five years down the line because of the physiotherapy, medications, belts and injections. They are not get relief with the pain of the knee and hip surgeries, hip and knee arthritis patients. So these patients are a very severe pain. So they cannot go to the social activities, they cannot walk in the room, or they don't go to the social activities. So this is very rewarding because patient immediately after surgery, within 1 to 2 months, he will start doing all the daily activities. So this is very rewarding for surgeon as a joint replacement. And most common myths in joint replacement surgery, that is not successful surgery. Then it is failed within 1 year or 2 year, and this is not good for the elderly patients. Basically, this is now with the advanced technology like robotics, new types of joints are coming in the market now with the new inventions, and is generally done in the surgeries geriatric patients only. Like after 60 and 70 patient will start getting the wear and tear, will go the advise the surgery in the elderly and the geriatric patients only. So this is nowadays very successful with the new technologies and new designs of the implants.
So, after what age do people really start facing these knees and joint problems?
Yeah. So basically, after 40s and 50s, they start getting little bit aching, pain in the joints because this is just startup of the wear and tear in the knee and hip joints. But basically, severe arthritis develops after age of 60. So this is most common reason in the it is come as the primary reason, that is which going to come with the age,
I see.
like your cataract, your graying of hairs. So similarly, wear and tear will start and it maximum after age of 60s. So generally after 60s and 70s, patients start getting more and more hip and knee pain. Then patients with some obesity and some hormonal issues, hypothyroids, they get the more and more wear and tear early in the life.
So, over the years, how have you seen patient expectations change as far as mobility and recovery is concerned?
Yeah. So now we'll tell this surgery as a fast track surgery. So why it is fast track recovery surgery? Because there are a lot of changes since last 10-15 years coming with the newer research. They are coming in the this robotic technology. First and foremost is your robotic technology. So robotic technology has minimum blood loss, minimum bone loss, then pain is less, and because of all these things, inflammation is very less. So
See.
patient's recovery after second day, patient start walking. Within 3 to 4 weeks, patient is completely independent at home activities, and 3 months will be completely active as a normal person. Along with that, we have some injections in after surgery is called as epidural anesthesia or blocks. So because of that, initially 10-15 year back, pain was severe after surgery. So patients have more and more fear about the pain and recovery about the joint replacement surgery. But with this all epidural blocks, nerve blocks, pain is very less. You can say 90% pain is gone down within on first day only.
I
So
see.
the recovery is very fast. Then their stay at hospital also is less. So with new technologies and new advances in technology and implants, recovery is too fast nowadays as compared to the 10-15 year back.
So, robotic technology when it was introduced. So if you compare it to the surgery earlier, what is the time difference? Is this much quicker?
Yeah. Okay. So this is much. So that is why it's called as a fast track recovery, because in these surgeries, bone loss, blood loss is less, then ligament release is less, and if you see the accurate placement of the joints on the bones is there. So if you change the angle of the implant putting in the joints, that bending is too much painful. So this precision of the putting the joint proper position and giving the longevity, because of that longevity of the joint is also increased, because initially it was we are aiming at 10-15 years, now we are aiming at 20 to 25 years shelf life of the this joints, because of this robotic technology. So this all because of this all new technologies will get the good results with the robotics.
And what is the impact of this robotic joint replacement surgery?
So basically, as you explained earlier, so it is more precise and more advanced. So our cutting edge technology gives us the good movement in the joints, less pain and less inflammation. So that is why patient within second day will start get discharged. 2 to 3 weeks, patient is dependent. After 2 to 3 months, patient can travel by bus. He can go and work in the fields also. He can go for small trekking also. He can do swimming, cycling. So basically, patients can do all low impact activities in the sports also and daily activities also. So their life changes drastically from non-mobile to the mobile after within the 1 to 2 months after the surgery.
And how do you make robotic joint replacement surgery really successful?
Yeah. So robotic joint replacement surgery, it has work up with multiple factors are there. First is technology you are using nowadays. Last 4 years, 5 years at our center we are using it from all the patients who are doing the robotics now. So as I told, it's precise and advanced technology. Along with that, whatever joint you are using, it should be US FDA. So because of that
The US FDA, the Food and Drug.
yeah.
Yeah.
So that if they are US FDA approved, then your quality of the implants, quality of the metals, and quality of the alloy is very good. Then other thing you have to use is always go do the surgery at the tertiary care hospitals, because if you get admitted, already patients are in elderly phase. Then they anytime they land up into any emergency before surgery, after surgery, or in the surgery also. So they should get the emergency treatment immediately. So they should have good setup of the ICU to get the emergency treatment. Then they should have the good operation theaters like green OTs, then good atmosphere, at par services or technology at the operation theaters. So if you take good quality robotic technology, USFDA implants, then tertiary care hospitals, well-equipped operation theaters, then you will get the more than 90% success rate in the joint replacement surgery.
And what are the most common reasons that people require joint replacement surgery?
Yeah. So most common, as I discussed earlier, is primary osteoarthritis, that is aging. So as you grow old, cataract, graying of hairs, that is coming in the picture. So similarly, this is aging process. After 60, 65 is a very common age when you get the severe arthritis in the hip and knee and you require the robotic surgery. Other part of this are the early phase, they will require in age of 40s and 50s, they are the arthritis patients. It's called as rheumatoid arthritis, gout, ankylosing spondylosis. This patient will require early or knee replacement or hip replacement, because their activity has gone down. They are in too much pain. So in this age, in these conditions, arthritis will ask the patient to do the surgery in the early age. Then obesity is there. Then some hormonal issues like hypothyroidism. Then some fractures in the joints in the hip and knee. So these patients generally require hip and knee replacement surgery. If their mobility has gone down, their social activities are impacted, then we advise the robotic joint replacement surgery.
So these fractures which take place, is it mainly, because of an accident or is there some other reason?
Yeah. So there are multiple reasons fractures. First and foremost in India, high velocity trauma, because nowadays road infrastructure is changing. Then so that is why high velocity changes. So patient will get hip fractures, hip dislocations, then fractures in the knee joints. So these people require early age because of the arthritis they develop and their activity is gone down. So there are other reasons, that is osteoporosis. So nowadays our activities are all sedentary. Sitting job, then you have the cars, you have the mobiles and work from home.
Sedentary lifestyle.
Sedentary lifestyle. So this has changed the culture of our society. So now we are more and more sedentary. So that is why whatever our parents and grandparents were doing, so we are doing at least only 10% hard work or physical work we are doing as compared to our seniors. So that is why these changes of osteoporosis are happening early in the age, like 50s and 60s, because our physical activity has gone down. Then our food habits, like your canned food, then processed food are more. So that is the osteoporosis more. So basically osteoporosis, accidents and some sports injuries, they will lead to the early fracture and will require sometimes they require the joint replacement
Joint
surgeries.
replacement. So, how do you see the future of arthritis treatment evolving, both in terms of technology and awareness?
Yeah. So basically, evaluations and refinement in the joint replacement surgery is going on up till now, because we are at a one stage when we are just doing all surgeries with some instruments and some human judgment, like eyeballing is called as. Now 10 year back, now after 10 years down the line, we are giving the all the robotic technology, which is more precise and more advanced technology. So there more room for that, for more in form of your bone cutting and your precision with the machines, then implant designs. They are keep on changing. Research is going on. So there are a lot of things we need to change in the joint replacement in the future with a better, fast, and quicker recovery.
So we already discussed lifestyle changes.
Yeah.
That is very important. Exercise is important.
Yeah.
Um, who is more likely to develop arthritis? I think
Arthritis.
we also discussed that.
Yeah.
So, what are the top surgical treatments options available in early stages?
Yeah. If patient generally comes into our OPD in age of 40s and 50s, so these patients generally sometimes they are obese or residential lifestyle people. So in that phase, we advise them go for some CT scan or MRI, and we diagnose whether there is early phase of wear and tear, like meniscus injury, then cruciate ligament injuries, or in the kneecap cushions injuries are, or wear and tear is there. So early phase, we generally give them the physiotherapy medications. If they don't settle with that, we'll go for the knee preservation surgeries. So what are that? There are laser surgeries that will just go and repair meniscus, we go and repair the articular cartilages, then we repair the ligaments are there, MCL and LCL. So we preserve the joint until patients in develop severe osteoarthritis, severe pain is there. We want to preserve the joint with the knee preservation surgeries.
So, this robotic surgery, is it only for knee replacement, or is it for the hips or all joints of the body?
So now this is the evolution going on. So now in robotics is mainly in for abdominal surgeries for surgeons. In orthopedics, they are evolving much faster because bone is hard, and as your metal cutting technologies, your burying and saw cutting, so that is why orthopedics is adapting more and more with the this robotic technology, because we need to cut the hard bone. So they are basically now at this moment they are only knee and hip replacement surgeries.
Knee and hip.
Yeah, and they are in the spine also. When we get the again spine is again bones are there. So putting the screw and getting the proper three-dimensional view of the spine, will get in the robotics in the spine also and in the shoulder also. So these four joints are there now at the present, but further studies going on.
So, when people get knee or hip pain, at what stage do they should consider replacement surgery,
Yeah,
robotic replacement
robotic.
surgery?
So generally, as we discussed earlier, primary osteoarthritis develop age of 60 to 75 age group. But some people who has obesity, so these patients basically they develop the arthritis in early age, 50s and 60s. So there is a no age bar for the joint replacement surgery. So it depends your quality of life. If your pain is severe, you are not able to walk for 5 to 10 minutes. Climbing the stair is very painful. Sitting on the floor is not possible because of the knee or hip pain. So basically, your mobility has gone down. You are fed up, or you are tired of getting medications, physiotherapy, belts, injections. So basically, lifestyle changes and severe pain. So this is the main line of indication for the hip and knee robotic joint replacement surgery.
So, this robotic joint replacement surgery, is it being done uniform across the globe, or doctors are just doing what they were doing earlier also, or is are all hospitals in the world using just robotic joint replacement surgeries?
Yeah. So again, here comes is your part of the cost. So because these machines they are made after 10 to 15 years of research, so they pour a lot of money in that. So company will charge extra also for that. So that actually it is very expensive. Machineries are there, so that is little bit expenses there, but it is going down nowadays. But at the selective hospitals worldwide, it is doing the robotics replacement surgeries.
So, though it may be expensive, it is much more effective.
Yeah.
Yeah.
So if you see the cost effect and your benefit effect, so it is much at par. Your effects are getting the patient, so they are more happy to do the robotic surgery if you neglect the cost part.
So if you take robotic surgeries and non-robotic surgeries, So what is the success rate? Which produces more?
Anytime you need to change. If you don't change and if you don't follow the technology, because here, as you say, while cutting the bone, if I cut it 2 degrees more or 4 degrees more in the angle, so it will trouble you for the getting the joints in proper position. So your position is impacted, your movement is impacted, and patient always remain in the pain. So precision is very important. That should get with from the technology. So always adapt to the technology. You never neglect technology, because technology is the only future. With the technology, so with AI and human intelligence, we can give the at par results to the patients. We can will do very good results for the patients.
Dr. Aniket Patil, it was a pleasure, having a discussion with you. Thank you for
Thank
speaking
you.
with Pune Times Mirror.
Thank you. Thank you.